Why does chest physiotherapy disrupt your cystic fibrosis routine? Imagine trying to keep your lungs clear while juggling a busy day. Chest physiotherapy, or airway clearance therapy, is a vital part of managing cystic fibrosis because it helps remove the thick, sticky mucus that builds up in the lungs. This mucus is much thicker than normal, which makes it harder to breathe and increases the risk of lung infections and inflammation. To clear this mucus, healthcare providers use different techniques like manual percussion, vibrations, postural drainage, or mechanical devices. These methods are effective but can sometimes interfere with daily life. One big reason chest physiotherapy can be disruptive is that it takes a lot of time. Most sessions last between 20 and 40 minutes, and many people need to do this every day. This can make it difficult to keep up with work, school, or social activities. The physical effort involved can also be tiring, especially for children or those with more advanced lung issues. Performing these techniques repeatedly can feel like a burden, especially when you're trying to fit it into a busy schedule. Another factor is that chest physiotherapy can cause some discomfort or side effects. Some people experience muscle soreness, pain in the ribs or spine, or bronchial spasms. Others might feel lightheaded, cough a lot, or even vomit after a session. These sensations can make sticking to the routine challenging and might cause some to feel discouraged or frustrated. The discomfort can sometimes feel like it's disrupting their daily life, even though it's helping their lungs in the long run. The immediate effects of chest physiotherapy on lung function can vary from person to person. Sometimes, the improvements in lung measurements like forced expiratory volume are minimal or temporary. This can lead to feelings of doubt or frustration, making it seem like the therapy is more of a hassle than a help. But it's important to remember that the benefits of clearing mucus regularly are seen over time, helping to prevent infections and preserve lung health. Managing cystic fibrosis often involves a complex routine of treatments. Along with physiotherapy, many people take inhaled medications, enzyme supplements, and nutritional therapies. Coordinating all these treatments can be tricky and may feel overwhelming. Finding the right schedule that fits into daily life requires effort and planning, which can add to the sense of disruption. There's also an emotional side to consider. Performing chest physiotherapy every day, sometimes multiple times a day, can be a constant reminder of illness. It might affect mental well-being, causing stress or feelings of frustration. The routine can sometimes feel like a burden, impacting overall quality of life. Despite these challenges, chest physiotherapy remains a cornerstone of cystic fibrosis care because it helps prevent lung infections, keeps mucus moving, and supports better breathing over time. Healthcare teams work closely with patients to personalize therapy plans, choosing techniques and schedules that aim to minimize disruption while maximizing benefits. Newer devices like oscillating positive expiratory pressure tools and tailored airway clearance routines are designed to make therapy easier and less time-consuming. In summary, chest physiotherapy can disrupt your cystic fibrosis routine mainly because it is time-consuming, physically demanding, and sometimes uncomfortable. It requires careful planning and support to fit into daily life. But it's an essential part of managing lung health in cystic fibrosis, and with the right approach, many people find ways to balance therapy with their everyday activities. Always consult your healthcare team for personalized advice and support to make this routine as manageable as possible.